Hi, Dr. Shmaila here. Today we discuss chapter number 6, that is relaxation. Our learning objectives. What is relaxation? Difference between muscle and postural tone, types of relaxation, and then techniques of relaxation. What is relaxation? Definition. Muscles which are relatively free from tension and at rest are said to be relaxed. Tension develops in the muscles as they work during contraction, and this tension is reduced to variable degree as the muscles come to rest during relaxation. So we can say the phenomena by which muscles are free from tension by using local and general relaxation techniques in order to relax the body is called relaxation. Muscle tone. Tone, what is tone? Tonus is a state of contraction of the resting muscles. Under ordinary circumstances, living muscles are never completely free from tension as they retain a quality of firmness known as muscle tone, even when they are as relaxed as possible. Muscle tone, which represents a state of preparedness in the resting muscles, is now thought to be maintained through the activity of the muscle spindle circuit. The efferent fibers of the small fiber nervous reflex pathway transmit impulses which produce a sustained contraction of the small interphalangeal muscle fibers of the muscle spindle, while the large extraphalangeal fibers concerned in the production of the voluntary movement remain relaxed. Look at this diagram. Muscle spindle, maintenance of the muscle tone, stretch reflex in the bicep brachii muscles. These are the sensory neurons. Basically, these are efferent neurons, and then these red color signals are basically efferent neurons that respond by conveying impulses to the intrafield fibers that consist of nuclear chain and nuclear back fibers. And these are the extrafield fibers that remain relaxed. What is posture tone? The contraction which persists in the muscles concerned with the maintenance of posture, chiefly the anti-gravity muscles, is called posture tone. Postural tone is maintained and regulated by the reflex mechanism, the fundamental basis of which is myostatic or stretch reflex. Although the higher centers also exert a controlling influence, basically any stretching of the muscles by an external force, such as force of gravity, stimulates sensory receptors situated within the muscles themselves and so give rise to a discharge of motor impulses to the same muscles. These motor impulses bring about a contraction of a sufficient number of muscles motor unit to increase tension sufficiently to enable the effect of the force which produces the stretching to be counterbalanced. As tension in the muscle is increased in response to stretching of their constituent fibers by an external force and in proportion to the degree of the stretching to which they are subjected, it follows that use of measures tending to reduce or eliminate the effect of this force assists in promoting their relaxation. The degree and location of the postural tone varies with any alteration in the posture. It is greatest in the upright position, in which the force of gravity tends to stretch the muscles more strongly than it is in recumbent positions, I mean lying position, in which the effects of force of gravity upon them is adequately counterbalanced by the full support of the body. Those recumbent positions which provide full support for all segments of the body are therefore more suitable for obtaining general relaxation. So basically what is postural tone? The contraction which persists in the muscles concerned with the maintenance of the posture. Maintenance of posture, chiefly the anti-gravity muscles, is called postural tone. Look at this diagram. Basically, this is an example of stretch reflex. Stretch reflex elicited upon a tendon tap. Or fundamental point of view, simple stretch are basically consist of four, you can say 4 points. Number one, a receptor in the muscle generates nerve impulses in proportion to the degree of deformation. Then an afferent neuron conducts the burst of sensory impulses from the receptor to the spinal cord. Then an efferent neuron that conducts motor impulses from the spinal cord to the extrapial muscle fibers, and then an effector that is the muscle responds to the motor impulses. Look at this. Voluntary movement. Specific muscles contract as they work to initiate or control movement, but at the completion of the movement, they relax and come to rest. Contraction in any one group of the muscle is accompanied by the reciprocal relaxation of the antagonistic group to allow movement to take place smoothly. This fact is of importance during consideration of methods designed to obtain relaxation of a particular group of the muscles. Mental attitude. Mental attitudes such as fear, anger, and excitement give rise to a general increase in muscle tension, which serve as useful purpose by preparing the muscles for rapid or forceful action. Normally, this tension developed to serve a useful purpose is relaxed when the need for it no longer exists, but in some cases it persists and becomes habitual. Recognition of a state of tension followed by the voluntary relaxation of the muscles in which it is present provides a means of helping the patient to economize in nervous energy, and in cases where the tension has resulted in the reduction of the normal range of movement in a joint, an increase in the mobility can be achieved. As you know, fear in one form or another is the most real cause of persistent tension. So, physiotherapist must do her best to reassure the patient and to gain his confidence and cooperation, to reduce tension and to relax the patient. An atmosphere conducive to rest, both mental and physical, contribute much to success in helping the patient to acquire the art of voluntary relaxation. Degree of relaxation. How we measure the degree of relaxation? Basically, it is possible by palpating the muscle, and when the patient falls to sleep during treatment, it is an ample proof that methods of obtaining general relaxation have been successful. So we can say degree to which the muscle tension can be reduced is variable, and it is better to regard the term relaxation as an indication that some reduction in tension has taken place. It is often possible to estimate the degree of relaxation achieved by palpating the muscle. For example, during massage, and the fact that patient fall to sleep during treatment is ample proof that method of obtaining general relaxation has been successful. Pathological tension in the muscle. Basically, a marked persistent increase in muscle tension or muscle tone is a feature of many pathological conditions which affect the nervous system. You can say this is the tension associated with disease or any pathology. Lesions of higher centers and those which interfere with the normal function of the nervous pathways which connect them with the spinal flex arc commonly results in an abnormal increase in muscle tension which varies from hypertonicity to spasticity or rigidity. A temporary reduction in the tension in the affected area can be achieved in some cases by suitable means which promote relaxation, and this allows re-education of any functional activity which remains to take place. How do you recognize a tense person? Basically, tense person may be easily recognized with some of the following signs and symptoms: frowning, tightness or clenching in the jaw and teeth grinding, raised or hunched shoulders, clenched hands and tightly crossed legs, drawn in and closed posture, a shallow or held breathing pattern. To relieve stress, we need to find the right level of muscle tension, enough for an active life but not so much that our muscles are exhausted. It is important to be able to recognize an exhausting muscle tension and then learn to be able to relax those muscles when we need to. Techniques of relaxation. Techniques. Two techniques basically: general relaxation and local relaxation. In general relaxation, our ingredients are sport, comfort, restful atmosphere, and then additional or special methods of promoting relaxation. Whatever aims of obtaining relaxation? As a preventive method, Relaxation is used as a preventive method to protect body from unnecessary wear and tear. As a treatment, to help in relieving stress in hypertension, then tension, headache, insomnia, and asthma. As a coping skill for calm down the mind so one can deal successfully with difficult situations. There are basically three systems involved in relaxation: nervous system, endocrine system, and then musculoskeletal system. So keep calm and remain relaxed and do deep breathing. Now start with general relaxation. Sport, comfort, and a restful atmosphere are basic conditions for general relaxation and may prove effective without additional methods. Sport. Various forms and modifications of the lying positions are used to achieve full support of the body. The relative suitability of each one varying according to the condition of the patient and to the individual preferences. The weight of the body is thus effectively counterbalanced by the uniform upward pressure of a reciprocal surface or by suspension in a position of semi-flexion which obviates all mechanical tension on the muscles or ligaments. Lying spine. In sport, first of all, we discuss lying spine. A firm surface is essential and if silent also, as in the case of a good spring mattress, is it ideal as it will mold itself to the body contours and give even pressure and comfort. At all costs, planes or beds which sag are to be avoided as they cramp the thorax and so throw additional strain on your inspirating muscles. Basically, we obtained relaxation by lying spine by the arrangement of pillows. A head pillow is required which is sufficiently soft to prevent the head from rolling to either side and to be well molded to support the neck posteriorly. Similarly, a small pillow under the knees relieves tension on the hamstrings and iliopsoas ligament and consequently allows the pelvis to roll backwards so that lumbar spine is straightened and supported. This is very important from MCQ's point of view. The feet are held in the mid position by sandbag or similar device and each arm slightly abducted at the shoulder and flexed at the elbow rest on a pillow. This is basically by arrangement of pillows we acquire or we teach patient how he or she is able to relax. A head pillow, a small pillow under the knees that leaves tension. Similarly, feet position is very important. Feet are held in mid position and arms position is very important because each arm slightly abducted at the shoulder and flexed at the elbow rest on a small pillow. Half lying. This is similar to the spine lying position, but breathing is easier as there is less weight on the back of the abdominal muscles. On the back and abdominal pressure on the undersurface of the diaphragm is then further reduced. An armchair may quite a good substitute for a plain third bed. The thighs are fully supported and the feet rest on the floor or a footstool or T-shaped footrest. So half lying method you can teach or guide in this position or in this position. Selection is your choice. This is basically suitable position for acquiring half lying. Prone lying. The head is turned to one side and may rest on a small pillow if more comfortable. Similarly, a firm pillow under the hips and lower abdomen prevents hauling of the back, and for women it should extend higher to avoid too much pressure on the breast. Similarly, the lower leg is elevated so that the knees are slightly bent and toes free. A degree of medial rotation at the hips causing the heels to fall apart further induces relaxation of the leg. Many find this position comfortable and use it for sleeping. Others dislike it because of the rotated position of the head. side lying. The measures of relaxation obtained is governed by the efficiency with which the shoulder and pelvic girdle are stabilized. The arm and leg, which are uppermost, may be resting on the supporting surface instead of pillows, but some of the weight then falls on the trunk, and this impedes respiration. The head pillow supports the neck and head in alignment with the body and must not be too high. The majority of the people sleep on this side, but few are conscious of the part suitable positioning for relaxation plays in promoting it. So it is basically your choice what position you adopt for relaxation. Total suspension also plays a very important role in acquiring relaxation. Each unit of the body is suspended by a suitable sling placed under the center of gravity of the part and attached by vertical rope to a strong overhead support. The arms are abducted slightly with the forearm pronated and the feet are held in the mid position by a supported sling and rope. The inclusion of the tension springs gives additional comfort and feeling of buoyancy as they stretch and recoil with the respiratory movement. Our second condition is comfort. The ingredients of comfort include freedom to breathe deeply, there is a warmth and abdominal quiescence, inactivity or sleep, and a mild degree of the physical fatigue. Removal of constrictive clothing such as corsets and belts is essential, and any garters, buttons, or suspenders liable to cause pressure must be removed. The room should be warm but should not have a free supply of fresh air. In winter, additional warmth can be supplied by the light, but warm blankets, a covered hot water at the feet, an electrical blanket are by non-luminous infrared irradiation, but care must be taken to avoid overheating as this leads to the restlessness. For home use, a warm bath gives the most even and pleasing type of heat, but its soothing effect must not be ruined subsequently by vigorous rubbing with the towel. A light, well balanced meal, rhythmical physical activity of short duration, such as brisk walk in the open air, and the attention to empty the bladder before treatment are all conducive to general relaxation. These are the basic ingredients of comfort and relaxation. So make every effort possible that to attaining relaxation of the patient. Remove Removal of the constrictive clothing is very important. Similarly, room should be warm and a comfortable environment is provided, and you have to guide the patient how to you attain warm and how you relax the body. Similarly, avoid light, well balanced meal, a rhythmical physical activity of short duration, such as brisk walk in the open air, are all well conductive elements for general relaxation. C. Restful atmosphere. As physical and mental relaxation are interdependent, an effort must be made to secure a state of mental rest. Treatment room. Treatment room should be as quiet as possible, as many people for whom training in relaxation is prescribed are highly susceptible to the disturbing influence of the noise. If you are worried by the complete silence, but generally it is the high pitched intermittent sound produced close at hand which is to be avoided. The continuous low pitched hum of the distant traffic tend to be soothing. Similarly, bright lights and strong colors such as red and bright yellow are said to be stimulating, where a room with low, well diffused light, with for instance green and peach furnishings, give a soft and warm glow and provide an ideal setting for relaxation. So always choose for your clinical setup green and peach furnishing. It is a concept of perfection, but much can be done with screens and chairs used with a little imagination even in busy department. Role of physiotherapist in creation of the restful atmosphere. Much important role. The most difficult and important factor in the creation of restful atmosphere, and one which determines the ultimate success or failure of the treatment, is the manner and bearing of the physiotherapist. She must inspire confidence, as fear in one form or another is at the root of much of the tension which he can help to relieve. Her or his appearance must be tidy and her dress suitable. She must be punctual and move calmly without hurry or hesitation. Her manner must be courteous, pleasant, and understanding, and her voice low pitched and clear. A simple explanation of the routine and any instructions required are given to the patient in language and terms which he can understand, so that any anxiety or fear of the unknown is removed. It must be remembered that situations and routines with which one becomes very familiar often appear strange and terrifying when encountered for the first time. Conversations apart from these instructions should direct the patient's thoughts or contemplation of the restful and pleasant topics. Confidence in the physiotherapist and treatment is gradually built up over a period of time. Immediate results are not to be expected. So, it is the physiotherapist's responsibility to remain cool and calm. Often, immediate results are not to be expected and are rarely achieved, often because of the psychological factors beyond the control of the physiotherapist or patient. In successful cases, a habit of relaxation is built up in spite of a habit of tension, but the formation of new habits takes time. Regular and frequent practice on the part of the patient is essential until finally he becomes an expert in the art of letting go or relaxing and normal rhythm of life, in which activity alternates with relaxation can be re-established. What are the additional methods of promoting relaxation? Tension may persist in spite of the previous of the conditions conducive to the relaxation, in which case we use additional methods to help the patient to be relaxed. Very little should be attempted at first, the period of time being extended as the ability to relax improves. Consciousness of breathing. Under conditions of quiet and comfort, the patient mind may remain active and turn to mundane problems and anxieties with associated physical tension. In this case, it may help him to concentrate on his own rhythm of the breathing, which must be deep with a slight pause at the end of expiration. Expiration is a phase of relaxation and should be accompanied by a feeling of letting go in the whole body. Progressive relaxation. A method by which relaxation can be achieved progressively was devised and practiced by Jacobson of the Chicago, and something similar appears in the modern literature on the yoga system as the Svanasana, a still pose. Look at this posture. If you lie down in this posture, still pose, according to this technique, then you gain progressive relaxation. Contrast method. Difficulty in appreciating the sensation of relaxation is not uncommon. The patient does not know that muscles are tense or what to do in order to relax them. This can be taught by demonstrating the contrast between maximum contraction and degree of relaxation which follows. The patient being told to contract any group or series of the muscles as strongly as possible and then to let go and continue to let go. Success may be achieved by another method by which the patient is urged to step up this preliminary contraction until he is so tired that he has to let go. There is a large element of suggestion about this, as it is unlikely and undesirable that a state of fatigue should actually be produced. This method follows the biological principle that activity of living cells tend to be followed by the inhibition of dead activity. Routine contraction followed by the relaxation is carried out in each area of the body. The attention traveling in logical sequence from limb to limb and to trunk and head, including the neck and face muscle, until all areas can remain relaxed at one and the same time. But this requires much practice. Much practice may be necessary before this is accomplished. And it is not unusual for the muscles of the leg, for instance, to again become tense while attention has been focused on relaxation of the face muscles. Before the routine has been completed, patient frequently drops off to sleep and general relaxation is obtained. When possible, he should be allowed to wake up naturally. Alternately, he must be wakened gently in sufficient time for getting up and dressing to be unhurried. Later, patient learns to relax the muscle at will from the state of tension in which they are normally maintained and without previous voluntary contraction. Basically, in contrast method, the technique consists of a sequence of contraction of muscles performed usually in a distal to proximal sequence in each limb or pair of the limbs in turn, followed by letting go or relaxation for equal or longer period of time. Then the contraction for each limb parts are usually added to one another so that tension in the limb is total and relaxation should be controlled in the reverse sequence. Took this sequence an example. The sequence of command is as follows. For the arm, make a fist and let go. In brackets, alternative commands or explanations are given. First of all, distal to how we following distal to proximal sequence, then make a fist and let go. Similarly, tighten your wrist and let go. Pull your hand back or forward. Similarly, tighten your elbow and let go. Means you bend your elbow or straighten. Tighten your shoulder and let go. Similarly, for the legs, point your foot down or pull your foot up and let go. The patient chooses whichever is least likely to give him cramp. Similarly, tighten your knee and let go. Straighten your knees. Similarly, tighten your hips and let go. Tighten the buttocks. When the above sequence are added together, the command will be for arms. Tighten your fist, wrist, elbow and shoulder and let go shoulder, elbow, wrist and hand. Means stiffen the whole arm and let go. Similarly for the leg, tighten or point your feet, knees and hips and let go your hips, knees and feet. You can say stiffen the whole leg and let go. The commands for both pairs of the limbs may be added together as follows. Tighten the feet and hands, knees and elbows, hips and shoulders, and then let go in reverse order. Means stiffen your arms and legs and let go. For the trunk and head, we follow the command. Press your head against your support and let go. Press your shoulder against your support and let go. Deep breathing may be practiced with relaxation of any part of the body. It is more used to breathe in while tensing the muscles and to breathe out on letting go. Remember this point that when you tensing the muscle, then breathe in, and when you are relaxing or letting go, then breathe out. So this is very important sequence, but it is best learned by practice. So every step should be practiced on yourself. What is physiological relaxation as reciprocal method? This method of relieving tension was basically devised by Laura Mitchell in 1957. It is based on physiological principles of reciprocal relaxation. The physiology of this method is that basically antagonistic group of the muscles always relax reciprocally and equally to the contraction of the agonist group of the muscles. Tension will be relieved by the contraction of the antagonist muscles. In this technique, the muscles will take the patient out of the tense posture or those which are required to contract, with the consequent diminution in tension in the muscles that are maintaining the tense posture. The patient is allowed initially to remain in his tense posture and may lie or sit if he prefers, but especially comfortable positioning should not necessarily be offered. Better position will be achieved as the relaxation proceeds. For the success with this technique, it is important that the patient learns to recognize his own tension at any time and learns what to do to relieve it without necessarily changing his main working position. So the sequence used is more usually proximal to distal, and each part of the body is given three commands as follows: to move so that tense enfolded position of the body is opened up, to stop moving and to let the brain appreciate the new posture, making the patient think about the new position in which his body component is now resting. Time to should be allowed for this, and the patient should not be hurried. The commands are given as follows. For physiological reciprocal relaxation for the shoulders, push your shoulder towards your feet. For the arms, lift your arm outward and slightly straighten your elbows. For the hands, make the whole palm of the hand and your fingers to be fully supported. For the hips, separate the thighs. For the knees, straighten your legs slightly. For the feet, point your feet away from you. Similarly, for the head, press your head into the support or backwards. For the upper trunk, we can say press your back into the support or backwards. For the jaw, without necessarily opening your lips, push up the lower jaw away from the upper jaw or towards your feet. Breathing for this technique is usually achieved at gut depth by asking the patient to sigh and to appreciate what is happening to the waist. To be aware that waist is becoming smaller, even that ribs are folding down like a bird's wing. This is all command for promoting physiological relaxation. So we can say physiological relaxation is basically you can say this reciprocal relaxation. You can say that contraction of the agonist group of muscles will be followed by the reciprocal relaxation of the antagonist group of muscles. What is second method is local relaxation. General relaxation takes time and is not always essential or desirable. Methods of obtaining local relaxation depend to some extent on the cause and distribution of the tension, although the general principle of sport and positioning, comfort and confidence all play a part. First of all, we discuss massage, or you can say soft tissue mobilization and passive movement. Massage or passive movement both predispose relaxation of the area under treatment. Relaxation can be localized to the specific area by the application to that area of the general principles. A general attitude of rest, however, will assist this process. For example, abducted and flexed arms supported by table or slings is more inclined to relax when the patient lies or reclines in the chair than when he sits bolt upright. In preventing and combating adaptive shortening, persistent tension or hypertonicity of the muscles acting upon one aspect of a joint produces a state of muscle imbalance which lead to adaptive shortening of the tense muscles and progressive lengthening and weakness of the antagonist on the opposing aspects of the joint. Techniques which help the patient to recognize tension in a particular muscle group and to relax them voluntarily assist in restoration of the muscle imbalance and prevent adaptive shortening. To combat adaptive shortening, which has already developed in a particular muscle group, the use of suitable positions which produce a measure of traction on this group combined with strong innervation of the antagonist group to secure reciprocal relaxation may succeed in stretching the shortened muscles without eliciting the normal reaction of the contraction brought about by means of the myotatic reflex. So we can prevent sharpening by doing stretching exercise, choosing stretching maneuvers. The, what is the stretch reflex? The stretch reflex or myotatic reflex is basically a muscle contraction in response to stretching within the muscles. Similarly, a spinal reflex is a fast response that involves an afferent signal into the spinal cord and an efferent signal out to the muscle. Thank you. This is the end of this chapter. Hopefully you all like it. Thank you again.